As of today, we have 40 new cases to report for a total of 271 people who have tested positive so far here in British Columbia. And by health authority, 152 are in Vancouver Coastal Health, 81 in Fraser Health Authority, 22 are now on Vancouver Island, 12 in Interior Health area, and 4 remain in the north. We have unfortunately and sadly, one additional death to report here in British Columbia today. Of the cases that we have, 17 are now in hospital, so that's an increase from 13 from yesterday, with 9 of those people being in intensive care right now. We continue to have only 5 who are in our recovered list. However, we know that most of those people are actually doing very well. Their symptoms have resolved at home, as with most of our cases so far, and we are awaiting their clearance with laboratory testing. So a good number of our cases, particularly in Vancouver Coastal Health, are related to the 3 long-term care facility outbreaks that we've been following over the last little while. So, and the additional death that we mentioned today was again from the Lynn Valley Care Centre, where the outbreak is continuing there. We also have so far only 1 resident and 1 staff member from the Hollyburn long-term care facility, although that investigation, of course, is ongoing, and we know that there are people within the incubation period there as well. And yesterday we reported on the 3rd long-term care facility at Harrow Park, where the 1 resident from that facility is now in hospital recovering from that. So as we've been following in the last few days, we know that there's been dramatic changes in our society and in the things that we're doing here in British Columbia to do the best that we can to try and slow down and prevent the transmission of this infection in our communities, in our families, and in our province. This is not optional, and I want to be very clear that everybody needs to take these actions now. And this is what's going to protect us for the next few weeks. It's going to protect ourselves, it's going to protect our families, and going to protect our communities. The importance cannot be minimized. Having said that, I'm very heartened by some of the things that we've been seeing here across the province in people physically distancing as we've directed, but maintaining that so important social connection that we have with each other and that we continue to need. There are many innovative ways that people are doing things like virtual coffee dates, takeout windows at restaurants and entrances, people who are supporting each other, dropping off food, dropping off homemade goodies, taking people's medications to them. These are things that are really important to help us stay connected. In particular, we want to make sure that we're not socially isolating our seniors, who are the most vulnerable to having severe illness, people who have underlying illnesses, people with disabilities. And I'm calling on all of us to do what we can as our communities to support everybody. As individuals, I also encourage you to get outside. There are things you can do, even if we're doing social distancing. You can walk your pet, you can go for a bike ride, you can play with your kids. And these are the things that you want to do in a small group, as a family, together, and maintain your distance from others when you're outside as well. And inside, of course, there are many things now that are being available to people online. There's courses, there's exercise classes, there's e-books, there's many museums now that are putting information online, putting their paintings, their holdings online for people to be able to access and use. These are educational opportunities as well for you and your family. I think this is, as I mentioned yesterday, a really critical time for us. This is the time we need to build that firewall. We need to stop the transmission of this disease. We need to stay connected while we're staying apart. And we need to take care of each other while we're doing that. Thank you.
Thank you very much, Dr. Henry. And of course, today we are announcing that an additional person who's passed away from COVID-19 associated with the Lynn Valley Care Home. And our hearts go out both to their families and to the people working at Lynn Valley who will obviously be shaken and saddened by this as we are. As Dr. Henry has said, we have 40 additional cases today. That's 271 province-wide, 17 in hospital, and 9 currently in ICU. And of those in ICU, 8 are in the Vancouver Coastal Health Authority and 1 in the Fraser Health Authority. Just to keep you up to date on some of the activities, we're obviously, as all of you know, we'll be announcing our weekly testing number tomorrow morning through the BC CDC website. That testing continues. The work is going on 24/7 at the BC CDC and around BC at other sites that are processing testing. And obviously that effort, which is a science-based effort, is continuing full throttle. I wanted to say something about a question I was asked yesterday about MSP coverage for people returning to British Columbia. The chair of the Medical Services Commission has made the following decisions regarding MSP coverage: that the MSP coverage wait period will be waived for those who are returning from impacted areas and intend to stay in BC. We're also waiving the wait period for those who return to BC, and it is found that they were outside of the province for longer than the allowable time period to maintain MSP coverage. MSP beneficiaries who are out of province and are unable to return but may be provided with temporary coverage. We also must address those who have expired BC Services card. Beneficiaries who are either unwilling or unable to attend an ICBC office can contact Health Insurance BC and request a confirmation of coverage letter advising that their MSP coverage is still affected. Note that a beneficiary may use the personal health number on their expired BC Services card to access provincially funded healthcare services. They just need to show another piece of ID. Finally, for those who have applied to MSP but still need to complete the MSP enrollment by attending an ICBC office, we are providing a period of temporary coverage that will result in a letter issued to the individual stating that they have MSP coverage. This letter with the issued personal health number may be used to access provincially funded health services. There will be a statement from the Commission, or I believe that has or will be going out, that confirms the details of all those information. I want to thank all the people working at 811, which has been a lifeline for many people in British Columbia, answering literally thousands of calls a day. Also, the people who yesterday at the 188 COVID-19 number who answered 1,895 calls yesterday. And just note that our self-assessment tool at the end of yesterday had been accessed over 1.15 million times. Those are all significant achievements in being able to give people access to the information that they need. As Dr. Henry has said, there are extraordinary things happening all over BC as people work together to follow the directives of the Provincial Health Office and do what they need to do to support their community and support one another during this difficult period. And we are very, very honored and pleased as a community for the offers of support, the offers of both financial in some cases, but often just community support. The number of people who responded to Dr. Henry's request for blood donors yesterday, which I think is exceptional and speaks well of our province and who we are. Dr. Henry has made it clear from the start, what we ask British Columbians to do is based on the best science available. And part of that science also includes how each of us reacts when we're asked to join the fight against COVID-19, how quickly we join the fight, and how sustained our commitment is to it. We know that different people have different needs and responsibilities in their lives, but what we're saying is pretty clear. What we do today affects the lives of people everywhere tomorrow and next week and next month. What we do today makes a difference. The actions we take today are important. So right now and in the days and weeks and months ahead, we need to do what we're asked to do. We need to do it 100%. We need to do it 100%. And we need to keep doing it until we're told we can stop. That's the fight we're in. That's the reality we're in. And doing it together makes us better as a community, helps those that we love, helps all of the people that we live around, live with, and care for. That's how we wage our battle. Je veux dire quelques mots en français. Nous annonçons 40 nouveaux cas de COVID-19 en Colombie-Britannique pour un total de 271 cas en Colombie-Britannique. Parmi les nouveaux cas, 17 sont actuellement hospitalisés. Je viens d'expliquer en détail en anglais les chiffres. Nous sommes profondément attristés d'annoncer également le décès d'un autre résident du Lynn Valley Care Center qui a été testé positif au COVID-19. Nous offrons nos sincères condoléances à leurs proches et au personnel qui a pris soin d'eux. Sur le nombre de cas, 152 sont dans la régie de santé de Vancouver Coastal, 81 dans la régie de santé de Fraser, 22 dans la régie de santé de l'île de Vancouver, 12 dans la régie de santé de l'intérieur et 4 dans la régie de santé du Nord. Merci beaucoup. Thank you very much. We're prepared to answer your questions.
We'll now take questions. Today we'll take questions from the phone first. And again, a gentle reminder to the media, one question, please. We'll start with Justine, followed by Rob and Richard. Justine, go ahead, please.
Thanks. I'm wondering if you can update us on how many new ventilators you have en route. And with the current trajectory of the cases, hospitalized cases, when do you expect we would max out on ICU beds and ventilators?
Well, what we're going to do on ventilators is we're going to announce not when ventilators are en route, but when ventilators are here, Justine, which I think is the right approach. Obviously, we have ordered now some time ago those ventilators. We're looking for all the equipment we've ordered to come, and we're confident it's coming to help support our efforts. So, but we'll let you know when all materials arrive, not what we've ordered for obvious reasons. We want to stick in the present and not in the future in terms of the resources that we have. As Dr. Henry, I think, said yesterday when we were asked questions about modeling, she noted that all models are wrong. I think I got to get this down, Dr. Henry. All models are wrong, but some models are helpful. I'm learning as I stand beside Dr. Henry. We've done a lot of tests, and that's contributing to a lot of data being available about COVID-19 in BC that we can use alongside international data to do modeling. And we're doing that work on an ongoing basis and preparing that work. And there's a huge amount of questioning and analysis that goes into that. But we're not going to be hiding it from people. We're going to be sharing some of that work as soon as early next week with the people of BC.
Thank you. Next question, Rob Munro. Rob, go ahead, please.
Hi, Dr. Henry. I'm calling from Kelowna, and I'm happy to hear you say that you're encouraging people to get outdoors and walk the pets and get some exercise. But we're still unclear about the other side of it. Should people be going out and going to the hardware store and doing some shopping and carrying on life as normal as long as they follow the proper protocols, or should we all be staying at home other than to go and get a bit of fresh air now and then?
I think it's the latter. This is not a normal time, and we need to keep those distances between us. So while we need to keep essential services going, we need to make sure that we're able to get the groceries that we need, the sometimes hardware we need if we have issues in our home. But right now is the time we want everybody to lay low, and particularly people who have underlying illnesses, people with disabilities, people who are older and more vulnerable to having severe disease with this. We want you to stay home. And we need as a community to support people to be able to do that. So this is not business as usual. But I know it can be a challenging time, especially if you have children in a house or an apartment in a small place. So I am encouraging anybody who's not being required to self-isolate. So if you are somebody who's a returning traveler, if you're somebody who's been in contact with somebody and you've been directed by public health to stay home, that's a different story. You should not be going out, and you should not be going out to the grocery store and others. Have others help you with that. You can, if you live in a small home, or if you live in a home, you can go out in your yard for short periods of time, but you should not be in contact with others. And there's a whole bunch of other things that we've been asking people to do. But for the rest of us, yes, it is important to get outside a little bit now and then, and to make sure that you get some exercise, you get some fresh air. I think that is important for all of our mental and physical health. So I do encourage people to go out, but again, to maintain distance. Go for a walk with your children, go to the park with your children, but don't have a play date. This is not about everybody getting together and being outside together, because that's what we want to avoid. We want to make sure that we're far enough apart from each other that we're not going to be transmitting this unknowingly to others, and we can best protect our community by doing that.
Thank you. Next question, Richard Zussman. Go ahead, please.
This is a question about essential services. On the child care side of things, I know, Dr. Henry, you took some questions on this yesterday, and I'm just curious if the government is looking at fully subsidizing all daycare spots, direct billing the government like other health care, in terms of ensuring that those daycares can remain open, but also that parents will not lose their spot if they decide to take their kids home. And also on the essential service of dentistry, are you, Dr. Henry, ordering all dentists to stop non-essential work? Because we're hearing from dental hygienists that in some cases they're being required to come to work and do cleanings and other procedures because the college has recommended it, but they haven't heard that order from you.
So I have not ordered any other medical professions not to do this, but what we have put in place is social distancing. So clearly there is some difficulty in maintaining that. And the college advice, the College of Dentistry advice, I absolutely agree with. Dentists should be providing emergency services only during this period, and that is what the college is part of their plan. I think we need to absolutely be careful about other professions. So we're looking at physiotherapists, occupational therapists in the community, other settings in the community. They should be enacting the plans that separate them from people. And we want to be very careful that elderly people, for example, are not going in to see a physiotherapist or others. So I have not made an order that way, but that is something that they absolutely should be doing. And as a profession, I expect them to take those actions. In terms of childcare, my childcare belongs under several different ministries, including the Ministry of Health and Ministry of Children and Family Development. And as we've talked about, all daycares do not need to stay open, and we know that we've seen that. And many children, and most children, should be at home with their families right now, particularly since we know that many families are not working, and we've asked them to stay at home or to work from home. So that's important. What is also important is that we have that essential daycare services for the essential workers, particularly healthcare workers and others who do need to go to work to keep things moving and to keep our health system working. So that's what I have asked that be put in place, and I know that there are policies that are coming out to support early childhood educators. It's been involved in that, and the daycare programs. And part of the things that we have discussed is the making sure people don't lose their daycare spaces, and that daycares are supported so that when we move through this phase and when we get back to starting to get our society going again, that the daycares are there to continue the important work that they do.
Thank you. Next questions from Penny Daflos, Kat Slepian, and Mary Griffin. Penny, go ahead, please. Daflos, are you there? Next question, Kat. Yeah, go ahead. Penny Daflos. We'll go next to Kat Slepian and then Mary Griffin. Kat?
Henry, curious, you mentioned this a little bit with not ordering physiotherapists and such to stop practicing, but what about places like salons, hair salons, anything along those lines? That seems like the very opposite of social distancing, but a lot of them have continued to operate. Is there any thought as to shutting those down temporarily?
So what I said yesterday, and an order is a very black and white thing, and it doesn't allow for exceptions, and it doesn't allow for tailoring things to the certain environments. The criteria that are most important are that we are protecting the seniors in our community, and that we're protecting and keeping those distances from people. So clearly there are some areas that is a challenge, and we want to make sure that businesses that do stay open are able to support the essential needs that we have in our communities. And we'll be looking at this if it becomes a major problem. I haven't seen it be a problem in many places, but this is where I call upon business owners and professionals to do their bit to make sure that we are doing everything that we can to stop the transmission of this disease.
Thank you. Next question from Mary Griffin. Mary, are you there? We'll take the next question then from Shannon Patterson. Shannon,
Hello.
Go ahead. Oh. Mary, are you there?
Yes, I'm here.
Okay, go ahead, please.
Oh, hi, Dr. Henry. I just want to know, you had mentioned several days ago we were going to see a spike in cases because of a secondary test. And I'm just wondering, is this a trajectory that you were expecting with the number of cases? And what potentially can we expect going forward?
It's very hard to know what to expect. The prediction is not easy. We do know that the backlog is being worked through, and so the numbers of cases, and particularly the 86, I think it was, cases that we reported on Monday was a reflection of a lot of that. There is still very high levels of testing, so I expect we will continue to see cases around this level for some time. What we have been working on, and what we'll start to talk a little bit more about, and Minister Dix mentioned the modeling, but also what we call the epidemic curve, which looks at how this is progressing from when people's symptoms started. What we've been reporting is the day the testing comes back as positive, but that's not always a reflection of what's actually happening out there. So over the coming days, we'll have more information about that, which will give you a better picture of how this is actually progressing in our province right now. We still are on the upswing, and that's why it is so important that we take the measures, the social distancing, the physical distancing measures that I've been talking about right now.
Thank you. Next question, Shannon Patterson. Go ahead, please.
Hi, Dr. Henry, and also if you'd like to comment, can you talk a bit about the impact this might be having on the mental health of British Columbians? I think it's fair to say that the entire province, if not the world, is anxious, scared. The images on television are frightening. What do you think the impact is mentally, and what suggestions would you have for people who are really feeling anxious and scared right now?
I know this is something that has been concerning me for since the beginning of this, and watching the progression in China, the things that were happening in China. We know that when communities are in a crisis like this, in some places that exacerbates people's issues with substance use. It exacerbates domestic violence issues. It stretches relationships. If you are home with somebody for a period of time and you can't get out of your home, especially if there's children involved, so we know those things are happening. We know there's a lot of anxiety, and I hear it from the young people in my life about what's going to happen, and there's almost a sense of fear sometimes when you're walking around, and I certainly felt it last night walking here in Vancouver. But, the sun comes up and we realize that there are things that we can do to support each other. And there are resources. There's resources online at the BC CDC. There's some links to them as well to help people with mental health issues. Our community groups that are working with the people with substance use disorders, for example, have put out information to support people. And this is why it's so important for us to stay connected. And we don't have to be physically together to stay connected. And we've talked with our faith leaders last week about the importance of them supporting people. And we're seeing that happen. But certainly there's numbers people can reach out to if you have concerns yourself. And there's social groups as well that are starting up we have some information about how to talk to children about this, and we'll be putting more information out as we get more information in the coming days. But you can link it through 811, through the BC CDC as well.
Yeah, and just to say, it's why the decisions that get made are decisions that have to be concerned with the health of everyone. The fact we have COVID-19 has not changed the fact that people are struggling with mental health and addictions in BC, or that they struggle with cancer, they struggle with diabetes. And so that's why we really have to support our healthcare workers right now, because this is in addition to that. Someone asked, I think, last week, well, is the flu more serious than COVID-19? It's not that one is more serious than the other, it's that we have both at the same time, and that's why it's so important to push back as much as we can COVID-19. Today, just to give you an example, because many people are struggling and will be struggling with social isolation, this is particularly true of seniors, who we are particularly asking to be careful for the obvious effects of COVID-19. Today, the seniors advocate and our ministry, along with MLAs from all parties, we're working on plans to use the volunteer network in a safe way to support seniors around BC, and they're going to be reporting out on that tomorrow with new plans and new programs in place to support nonprofits that are doing that are reaching out to address issues of social isolation that we are trying not to be a byproduct of the social distancing that's required. But look, all of this, we know we're asking a lot of people, and we're expecting a lot of people, and so we need to also support each other in every way in this time, because all of the other issues that a society such as ours face and that individuals face, they continue to exist. Some of them are health challenges, some of them are other challenges. It's why we all have to participate and support at 100% what's been recommended by the provincial health officer.
Thank you. And just a reminder to the reporters that when we call out your names, to quickly unmute, because there are lots and lots of reporters on the phone. And when we call out your names, please do unmute as soon as you can. The next question from Moira, then Les Lane and James Peters. Moira, go ahead, please.
Hi there. Good afternoon. My question is about what the province is doing to prepare women's shelters from the spread of the virus, specifically as advocates are concerned about increasing risks of domestic violence in the province.
So there are community-level initiatives that are happening in each of the health authorities. As you know, we have an emergency operations centre set up provincially, but also in each of the health authorities, and part of that is reaching out to our community sector. It's involved with many ministries, as well as the Ministry of Poverty Reduction, Social Development and Poverty Reduction has been very active on this, and there's a committee. So there are some plans, particularly in certain communities, about how to support both women's shelters, but all of our shelter systems. We're working with the providers to ensure that we can identify, we can protect people in those systems, make sure we have improved hygiene and other measures to support people. I do want to make it clear that when we talk about mass gatherings and that no more than 50 people, that doesn't apply to people's homes, and in many ways shelters are people's homes. So we're working with the community who provides those services to make sure it can be done in as safe a way as possible, and that they have a plan should there be a need, should somebody develop the illness within that community and there be a need to support people. So that includes things like having a building or a hotel that somebody can be taken over, can be used to support people, either from a shelter for women who are escaping from violence and their families. So those are being done at a community level across the province.
Thank you. Next question from Les Lane. Les, go ahead, please.
Thank you. Dr. Henry, the BC 2012 pandemic influenza response plan, is that still guiding your thinking, or are we kind of long past the projections and the anticipations in that plan?
Yeah, so the framework of that plan is what we use to build this response. But there are some key parts of it that are not relevant. For example, there's no vaccine and there's no antivirals. And so those are key parts. But the principles that are behind what we're going to do to support people to take care of themselves at home, for example, what we do to support the social sector, the types of interventions that are needed in our healthcare system, those are relevant for what we are relevant for what we're doing now. The difference is, as we know, that this virus is different from influenza and it's transmitted over a longer period of time. The incubation period is a longer period of time, and those types of things need to be factored in. So some parts of it, absolutely, and the framework about how we're organized to respond comes directly from that.
Thank you. The next few questions on the phone would be from Shannon Waters, Srushti Gangdev, and Alex McKean. Shannon, go ahead, please.
Hi, Dr. Henry. We're starting to see some announcements now from grocery stores. I think it's Loblaws, which runs Shoppers Drug Mart, runs Superstore, announcing they're starting to restrict hours or planning to restrict hours at some of their stores. Do you have any response to that? Is that something that you would advise them to do, given what we've seen with people trying to stock up on groceries and other essentials at this time?
Yeah, so I know they've been taking this very seriously, and there's a number of strategies that they've been doing. So some of it is restricting hours. Part of that is for ensuring that their staff are safe and the staff aren't working longer hours and they can rotate and things like that. Other parts are to make sure that they can maintain the numbers of people. And I know some of them are having specific hours for seniors, for example, so that they're not potentially exposed to others in the same way. So I think these are all important things for us to do. We know that there's not, and we've been, even as early as this morning, we've been reassured by the Retail Association, the manufacturers, the food people, that there is not a problem with the essential materials that we need. Our supply chains are strong. Because of demand, it's sometimes taking a bit longer to refill than restock the shelves. So again, this is a way to try and encourage people to slow down and be thoughtful. I think they're also putting in place, restrictions on the numbers of things that people can take at any one time. I think these are reasonable measures right now, because we do not want people to be hoarding and to be stocking large amounts of things. We know that much of it will go to waste when we talk about produce. We know our supply chains are strong. They will continue to be strong, and there's a strategy that the ministry is working out, not the Ministry of Health, but ministries are working out. And certainly now that we have a Emergency Program Act and a declaration of emergency, that's something that allows us to work very closely with the Emergency Management BC, to work very closely with the retailers to make sure that's protected. We also want to make sure we're protecting the supply of medications that are coming in. So all of these things are worthwhile, and they really speak to our need to take a pause and to be thoughtful and to take what we need and to be reassured that our supply chains are strong.
Just, the Premier and the Minister of Finance, I think, met with the Retail Council of Canada recently. I want to say, first of all, and I think we know this, there's lots of people we count on in society that we sometimes take for granted, and the people who are right now working in grocery stores who are working under a lot of pressure, because there's a lot of people and there's anxiety in these stores, are people we count on, and we want to thank them very much for all their work. I think the message on both food and pharmaceuticals is get what you need and not more than what you need. As some of you know, I have type 1 diabetes, so I need to make sure I have a store of insulin over time, but I don't need to buy a year's worth of insulin, and it doesn't make sense for me to buy a second 6 months of insulin that I don't need, that could eventually affect someone else's access to insulin. So we need to buy what we want buy what we need at a particular time. I think that's important. I want to say that I think the grocery industry is on it. They're working forward on new rules to make things better, including make things better for seniors and getting access, seniors only hours, and I think they're very conscious of some of the images that have been portrayed over recent times, but also they assured us their supply lines are good, and some of the reason why they're reducing their hours is so that they can spend the time they need overnight to restock shelves.
Thank you. The next question is from Srushti Gangdev. Go ahead, please.
Hi, Dr. Henry. Just a question about bars and pubs and places with liquor primary licenses being told to close. I've heard from people in the community that a number of those places haven't closed, and I spoke with one business owner who says he's been told the order doesn't apply to him because he's keeping the capacity at under 50. Can you clarify that order? Is it being enforced, and what's your message to pub owners who are staying open?
Yeah, so it is an order for liquor primary licenses. Some pubs are in these are the technical things that I find out after these things, but some pubs have a restaurant license as well, so it may or may not apply. But the 50 does not necessarily apply. It depends on the premise, and it depends on your ability to maintain the appropriate distance between patrons within your pub or restaurant. And many places cannot do that, and therefore they've either gone to takeout or delivery or closed. So it is on a case-by-case basis. It is being enforced. We've been taking an approach to advise people to start, but we do have the ability, and we've been working with our police services around the province, that we can enforce these orders along with the support from the policing services, if need be. But most people, and I would appeal again to the businesses that are out there, do the right thing. And the right thing is, if you're not able to protect people adequately using the guidance that we've given, then you need to close for now. Close for your own benefit, close for the protection of your own family as well as your community.
Thank you. The next question is from Alex McKean, followed by Penny Daflos.
Hi, Dr. Henry and Minister Dix. I have a question about the outbreak that you've referenced a couple of times at Lionsgate Hospital. In particular, we heard that there were 3 administrative staff who were found to be positive with COVID-19. But now we're also hearing reports from people who have family within the hospital who are saying they're being restricted from visiting to prevent the spread of the virus. What can you tell us about how that virus and that outbreak has progressed within the hospital itself, and what's being done to make sure that families will be able to communicate with their loved ones who are in that hospital?
So Vancouver Coastal is actively on it. As you know, the incubation period is up to 14 days. So there are very strict measures being put in place across the entire hospital to restrict visitors, to restrict access to certain areas. There are a number of people who had close contact with the people who were sick, who are in isolation or are being monitored actively. So yes, it is very much a very strict protocol to prevent anybody else from coming in, either to get in, prevent them from being exposed or bringing in the virus again. And as you know, we've been using Lionsgate Hospital is also moving to develop a ward where we can care for people with COVID-19, given that they've been in this outbreak mode as well. So that's a way of facilitating that. So there's no new patients being admitted, emergency care is being provided. Having said that, it's very challenging if you do have a loved one or a family member who's in there right now, because the access is very limited. And I know staff are looking at innovative ways to make sure that people are connected and to make sure that people are allowed to visit their family member for compassionate reasons. And, the other thing is the numbers of visitors will be restricted quite severely, and it may just be essential. So those are measures that have to be in place for at least 2 weeks. So we're still in that incubation period right now. So it is still very much an evolving situation, and I know it's very challenging entirely for the staff there, but also for the families.
Thank you. The next questions are from Penny, and then Nick England, Vancouver Sun, and then Fairchild, Jay. So Penny, go ahead, please.
Can you hear me now? I hope you can.
Yes, we can.
Okay, thank you so much for your patience. Testing is taking a long time. Some people tell me it's taking a week or more for results, even though you're only testing sick people who fit very narrow criteria. The WHO says testing is the single most important thing to combat the spread. So I'm just wondering why we keep getting numbers of confirmed cases when the results are likely outdated and you're testing such a small number of people with symptoms. Isn't that minimizing the situation?
Well, no, we're not just testing people. Well, we're testing people with symptoms, and that is what everybody is doing. So it's not, that's not unusual. That's what we've always been doing. If you don't have symptoms, you don't need to be tested. The only people we are not testing at the moment are people who have returned from travel, who have very mild illness that is able to be managed at home. So that's hundreds of people, but we don't need to test those people if they're in isolation and they're not going to transmit this disease. And that's allowed us to focus the testing on healthcare workers, on the outbreaks that we're managing, on clusters in the community that aren't related to travel, and there's a lot of that testing going on. So for some people, there's a prioritization process for which tests get done. So for some people who might have been tested because they had mild symptoms related to travel or some of those things prior to the switch over, which just happened this week, to this new strategy, it may take longer than one would expect. But we know that the numbers have gone up to thousands of people a day who've been tested. So it's not like we're just testing a few people. We're testing lots of people, and it has been a challenge, as we've said, for the number of different laboratories around the province to consolidate those numbers. And some of the testing that is done, when the test results are given to people, or they're given to the public health unit to ensure that they're following up with people. But we are in a transition period right now. We've got some new equipment coming on, and the labs are working 24/7. So we're, I'm confident that this strategy will help us get a better picture of what's going on. But we certainly in no way are minimizing the amount of testing we're doing.
Thank you. The next question is from Vancouver Sun. Nick England, go ahead, please.
Hi, Dr. Henry. You just said that when it comes to enforcement of places that are breaking the social isolation rules, that you're doing a informed first sort of approach to that. Why are you taking such a gentle approach to enforcement so far?
Well, because most people are doing the right thing. And we have not had many instances where we've heard of or had issues with people violating that. There have been certain things in certain communities, and public health inspectors have also been going out and issuing orders on people directly and enforcing the orders. So this is, it's one of those things where when we ask people to do what they need to do, we give them the means to do it. Most people are doing the right thing.
Thank you. The next question is from Marcella Bernardo, News 1130. Marcella, are you there? Go ahead, please. Marcella, can you hear me?
Hello?
Yeah, go ahead, Marcella.
Okay. Yes, my question is regarding, we had the city of Port Coquitlam now closing playgrounds, all public playgrounds. Is this something that you want to see happen across the province, or is it, again, a case-by-case basis where you are encouraging children to still go out and play in playgrounds?
Yeah, I think it has to be one of those things where people use their common sense. If there's a group of kids all mingling together on a playground, that's not what we need right now. We need it to be in a controlled environment, and we don't want, and parents should not be letting children go and have play dates and go on to playgrounds with other groups of children, because we know that can transmit this virus, and then they bring it home to you, and they bring it home to your family, and we know that that's how it gets transmitted to seniors and elders in our community. So it needs to be on a case-by-case basis. It needs to be, we need everybody to do their bit to maintain that distance, to protect us all.
Thank you. The next question is from Graham Wood, Glacier Press. Go ahead, please.
Oh, hi, Bonnie. I'm just wondering about the testing capacity. Where do you want the testing capacity to get to? And do you want to start testing people with mild symptoms?
Yeah, so the testing capacity we want to get to is as much as we can. We are doing it 24/7, and they're ramping up. I don't have a specific number, but we want to be able to more effectively and more quickly meet the needs. We will be testing, and we are testing people with mild symptoms, depending on the circumstance. So if we think there's a cluster in a community, for example, in a family or in a group or in a grouping that's been somewhere, that's been together, and we started to see cases, we're testing all of those people. We're not restricting that. There's many people that we are testing that are involved with clusters or outbreaks. We're doing a lot of testing of healthcare workers because we know that that's been a source of transmission in long-term care homes and hospitals around the Lower Mainland. So the focus is to make sure that we can identify those clusters, those outbreaks really quickly, because that's where we need to really take action fast, and that may delay some of the testing for people who have mild symptoms, who've traveled, etc.
And just to note that I think on February 28th it was 1,000 people tested. I think it was about 1,500, 1,600 tests at that point, because some people were tested at that time multiple times. Then it was 2,000 the following week, which I think was March 6th. And last week you saw it was 6,225 or something like that, 6,325 maybe. And we're going to be posting the number tomorrow, and you're going to see just how significantly we're ramping up and have ramped up testing. So when we say that we're focused based on the science, the testing in order to protect everyone, that doesn't mean we're not testing dramatically more, doubling and doubling and doubling, and that will continue.
We'll come back to the room for a couple of questions now. We have CBC here. Go ahead.
Hi, Georgie from CBC The National. Just a question about the social distancing. We were out in the community today, saw some people training for basketball, people getting fish and chips at the beach. At what point, we're getting sort of mixed messages across provinces. You know, Ontario said today, don't have coffee with your friend, just talk to her over the phone. What's sort of how do we consolidate all these different messages, and also from the Minister to en français aussi?
Yeah, I think it's taken some time for this to sink in for people, and that's why we're trying to put the messages out again and again. I agree, and we're in the same place as Ontario. Don't go out for coffee with your friends. Don't mingle in groups together. Stick with your family. Stick with one or two people. This is not the time for those types of social interactions, and we all need to do our bit. So it's challenging. It's challenging, I think, for young people, because we're used to that type of environment, and we don't really feel the risk necessarily ourselves. And I just think right now, particularly for young people in our community, this is the time where you need to actually stay away from others. Don't go into groups don't be playing basketball with your friends, because you might take this home, and you might take this home to your grandmother or your parents or somebody who might get very sick with this and might end up in hospital. So everybody needs to do this now.
Et en français? En français. En français, la distance est la même, mais de toute façon, il est important en français. Nous savons que l'éloignement social est une ligne de défense importante pour nous tous. Donc, il faut garder cela et utiliser, en fait, un sens commun qui est de si c'est possible d'avoir des liens à distance, les liens sur le téléphone. Il faut privilégier ces liens à l'heure actuelle, et c'est pour le bien de tout le monde. Donc, je pense que nous avons été clairs. Je pense qu'il y a beaucoup de monde qui ont démontré beaucoup de créativité là-dessus, mais s'il s'agit de jouer au basket, peut-être c'est certainement pas le moment.
Thank you. And one question from Benoit, CBC, Radio-Canada.
A question for Minister Dix again in French and English, if possible. We see from Europe and the US that we have maybe more hospitalizations of people between 20 and 45 years old than initially planned. What is the case here? And if it's the case, should we send a message to younger people saying that they can as well develop more severe forms of COVID-19?
Je vais reprendre en français et puis je pense in English Dr. Henry will be better. Perhaps you'll go first. Let's go first and then you go to the medical.
Just so the age of the people that have been hospitalized here in British Columbia is still very high. The vast majority of them are over 60. I have some of that data. The age of people who have been infected here is slightly younger and primarily female, and that reflects that there's many healthcare workers that have been tested positive here in BC because of the outbreaks that we've had in our long-term care homes. But if we look at, there's still very small numbers of people under 19 here in British Columbia that have become ill. And we look at the data that just came out from the United States, the 4,200 and some of their first cases. Again, there's very little hospitalization, and nobody under the age of 19 ended up in intensive care unit. Less than 5% of young people under age 19 were hospitalized. So while it can absolutely cause effects in young children, particularly in infants, we know from China, right now we're not seeing that. We're still seeing the people who have most serious illness and are hospitalized or in ICU, and the deaths that we've had have all been in older people.
Thank you. We'll go back to the phones.
Et c'est juste en français que je pense que c'est très clair que ce soit les renseignements de la Chine ou aux États-Unis ou ici, que le plus gros risque c'est chez les personnes de troisième âge, n'est-ce pas? Ça c'est évident. Cela étant, le Covid-19 va avoir un effet sur tout le monde. Et il faut mettre tout le monde en garde, n'est-ce pas? Parce que c'est pas seulement une question d'une personne de 13 ans ou de 21 ans qui est avec le virus, mais l'effet de cela sur quelqu'un qui a plus de risque. Donc c'est important. Nous suivons à très près ce qui se passe au niveau international, les résultats d'Italie, de la France, de la Grande-Bretagne, bien entendu, et aux États-Unis, et en Chine, et au Japon, etc. L'évidence ici, les renseignements ici nous indiquent que c'est en prime abord une question de risque pour des personnes âgées, mais tout le monde a des risques et il faut que tout le monde prenne garde.
Thank you, and we have time for just a few more questions over the phone. Tanya Fletcher and then Keith Baldry, please go ahead. No, we can go to
Hi there. We're doing a story about myths and rumors. Dr. Bonnie Henry, what do you say to claims that heat destroys COVID-19? What are you learning about UV light and COVID? And just some background here, there's a Bikram yoga studio in Delta that's been claiming that this virus cannot survive heat, i.e. attend the yoga classes and you'll be okay.
Yeah, so there's a couple of things, and I think it's probably comes from some of the science that gets misinterpreted. So I think actually Bikram yoga studios, I shouldn't say it, but yoga studios are a place where people are sweating in close next to each other, at least the ones I go to, and that is a perfect environment to spread this virus if somebody is shedding this virus. So no, in that context it doesn't. It's probably a misinterpretation of the fact that we are that respiratory viruses like influenza, like some of the other coronaviruses that we've seen, tend to fade away when it gets warmer and we have increased amounts of ultraviolet light during the spring and summertime. So we don't see influenza, it just disappears, as it were, around this time of year. And that's one of the things that we've been really pushing is, we need to save our system till at least influenza goes away. And if we're lucky, this coronavirus may fade as well. It may wane away during the coming weeks because we know that some of these other respiratory viruses do that, and they're sensitive to the heat in our environment and to ultraviolet light. But that's not in a room or in an enclosed environment. Like we can't. UV light does work for some bacteria and viruses in the healthcare setting, but it's very intense UV light for many hours. So that's not an option. We've looked at for influenza, for example. And, sorry, you're getting me started about some of the other things that we've been following for a long time, but. We, for influenza, they've looked at whether we can increase humidity in certain environments and make that less transmissible between people. But it doesn't seem to work in that sense, but it does work when our climate, our temperatures and weather patterns change, and when we move into spring and summer, and we see all the respiratory viruses tend to move away. And in terms of misinformation, I did do some follow-up around ibuprofen, which people had asked about, whether you shouldn't be using ibuprofen. And there was a comment that had been made by a French politician around that. And it was based on some of the concerns that we've had in the past about aspirin and other things that can cause certain people to have exacerbation of influenza disease. So there is some sort of biological plausibility behind it, but there is no evidence, and the WHO has issued a statement on that again. There's no evidence that use of non-steroidal anti-inflammatories, that type of medication like ibuprofen or Advil, has any detrimental effect on people who have COVID-19.
And just on rumors, and overwhelmingly, healthcare professionals are not spreading rumors or making claims. But just to be clear, there's no cure for COVID-19. There's no cure. Dr. Henry has said it many times, and there is none, and there's no vaccine. So, if anyone's making such claims or making such suggestions, then, as I say, if you encounter them online, block them and unfollow them. And if they're in your community making claims like that, then if they were registered as health professionals, report them because those claims are false.
On that line, there are some treatments that are investigational, not cures, but treatments, and chloroquine is one of them. There's a number of other remdesivir, which is an anti-HIV medication. There's been some clinical trials that are ongoing that we're looking at being part of here in Canada as well. So, we're hopeful for those, and this is why we're doing what we're doing right now. We're doing everything to try and stop the transmission of this virus now so that we can buy ourselves time for either a vaccine or an effective treatment in the coming months.
Thank you, and we'll wrap up the presser with one last question from Keith Baldry. Keith, go ahead.
Dr. Henry, it's evident from the questions today, everybody's got anecdotal evidence, plenty of evidence of people not following your recommendations on social distancing or not gathering in large groups. And given what we're seeing in some of the European countries right now, why not, or do you envision moving to a much more aggressive clampdown on activities and bans on activities and closure of things?
We are obviously watching this very carefully. This is, I can't say it enough, this is not optional. This is for everybody, and we do have the legal authorities to enforce it. I'm calling on people's civic duty right now to do this, and it is in your best interest to take these measures as well. If you're somebody who's working in the community and you think it's okay to have a group of people in your business, it can affect you and your family and your business as well if this is introduced into your community. So do what we need to do. It's incredibly important right now that everybody take these measures. And if you cannot do it in your business, then you need to shut it down for now. And there's support that will be there for you. But this is the measures we need to take now for all of us. And, it's not optional, and we will be watching it and we'll be monitoring it. The things that we are doing today are going to save us in the next 2 weeks. So please, as I said before, this is our time. We need to be kind, we need to be calm, and we need to be safe.